the PT program. It has had a focus since its inception of developing really, really high-quality clinicians. And so these are folks who are going to go out and treat patients at a very high level.
Coming out of high school, you can elect to do a 3-in-3 program, so that will cut out a full year of school. So typically, if you were to do 4 years of undergraduate at a different school, you would have to apply to the 3 years of graduate PT school.
The students who get accepted into that program, if they maintain a 2.8 GPA in their science courses, they automatically have a seat in our professional phase, which is the 4th year.
On that 4th year, you graduate and you finish up your degree as an undergrad, but you also start grad school classes at the same time, where you do grad school for the next 3 years.
The good thing about Daemen as an international student is that coming from Canada, PT programs inside Canada aren't a doctorate, they're considered a master's. So because this is a doctorate program and because I am experiencing more schooling and being taught more things, Daemen almost over-prepares you for clinical practice.
I love it because Daemen provides a system where you build on your knowledge.
Daemen has continued to look at upgrading their facilities. I think that technology is important, but we have several monitors in each room where students have access to see the screens without a problem. We provide all of our students with our materials up front.
One of the biggest things that we're able to do now is kind of take a lot of what our lecture material is and have it on our own devices. And I think the professors do a really good job at formulating their lectures so that we have a better experience in terms of what we're learning. And outside of our lecture experience, we also have multiple lab experiences.
A lot of our lab rooms, they're meant to simulate real clinical settings. So we do have the experience working with the equipment that we will use out in the clinic.
Our students are involved in a clinical exposure class where they treat patients each semester that aligns with the course content that we're teaching at that particular time.
I love the opportunity to be able to apply what I've learned in class in a guided setting on campus. It's very hands-on, it's very active learning.
We're already getting that experience on how to handle tough situations, how to educate patients.
Then from the clinical side, all of our students do 4 9-week clinical internships in different practice settings that prepare them to practice once they graduate.
Clinical internships is a little bit different from clinics in terms of you actually go to a clinic for 9 weeks. As you progress through it and as you get more comfortable speaking with patients, asking questions, you just grow in confidence.
Approaching my first clinical, I was pleasantly surprised that I truly did feel very prepared to go out into the clinic.
From a clinical perspective, they're really, really well prepared, and they develop professionally through different organizations and working with world-class faculty.
The faculty has been a tremendous help supporting me through the program, especially for me coming from Canada every day. I experience longer days than most of my classmates, and the faculty understand the fact that I'm going through a lot when going through the program.
Faculty have been just so personable to us. They want to get to know us. They know the course load. They know how much we're all learning, and we're all working really hard. And that's just something I've been really able to appreciate, is that they're there for us.
They really do care about you and your progress in the program.
In terms of what we look for students are really students who have that intellectual curiosity, where they want to come in, they want to work hard, and they want to learn, and who has a passion, like I said, to want to treat patients, which is just a wonderful attribute. And so you get students who have that, they're easy to teach at that point.